Patrick McGill, Executive Vice President and Chief Analytics Officer at Community Health Network. Dr. McGill, thank you so much for joining today. A pleasure to have you on. You have a unique background. Not only are you still a family physician, as well as obviously by training and still in practice today, but you're also the Executive Vice President and the Chief Analytics Officer for Community Health Network. Unpack that a bit. How does that all come together? Share a little of the background there on how a family physician comes into being the chief analytics officer for an organization.
Yeah, well, thanks for having me here today. It's great. It's always great to tell the story about Community Health Network, and so, I think that we're, it's a great organization based in Indianapolis, Indiana, and we're doing a lot of great things over the last few years. So, my background, you are correct. I am a family physician. I still see patients one day a week, and that's my roots, and that's my training, and that's what I'm really passionate about. And so I always joke and say I'm kind of an accidental informaticist and changed to a chief analytics officer. And so my journey started when we implemented Epic back in 2012. I got involved with optimization and became the physician lead for medical informatics and optimization. I got trained as a physician builder by Epic, and that really started my journey down really process improvement and clinical outcomes driven and then data and analytics. And we've got some great partnerships. One of them obviously is with Epic, another one's with Health Catalyst. And so about 5 years ago we really made a transition to have the organization really focus on data and analytics and really be a priority and leverage all these great tools and technologies that we have in the organization. 3 years ago we created the Chief Analytics Officer role. We pulled analytics out of IT and create a separate division with an analytics center of excellence, and I was named the first chief analytics officer for the organization. I don't have a formal analytics background or training. I actually have a chemistry degree, but I've always been involved and really interested, even going back to my medical school days, on clinical quality, outcomes, process improvement, and so that's really driving. Following my passion is really how I ultimately made it into this role. And for those that don't know about Community, we do have a unique structure now with this role as Chief Analytics Officer. So like I said, we pulled analytics out of IT, but then about 9 months after that, we reorganized and put IT underneath analytics, including clinical and nursing informatics, performance improvement, regulatory reporting, and now business continuity planning as well. So when we say we're data driven and analytically led, we really walk that walk, and I have a great team of very dedicated individuals surrounding me, and that's what allows me with my unusual background to be able to be in the position that I am.
That's so exciting, and thank you for sharing a little bit of the backdrop, Dr. McGill. Very, very helpful for our conversation today. And so going into that, are there some common misconceptions in either direction between practitioners and health IT executives?
Yeah, I think that there are. I think some of these have been driven by the EMR implementations over the years, and there's a lot of information out there about how EMRs have contributed to physician burnout and the struggles. And so that's really one of the things that got me involved in this area, was really how do we leverage the EMR to drive improvement and to assist physicians and clinicians, including nurses and APPs and others, to really be a tool in the toolbox for improvement and for improved patient outcomes. So I think that's one of the misconceptions, is that the EMR is this huge burden that should hold us back, and it really doesn't have to be that way. I think the other misconception is that healthcare is EMR centric, and certainly the EMR is a critical tool that we use. I'll oftentimes in other conversations will liken it to, it's the new stethoscope, that you wouldn't practice medicine nowadays without an EMR, just like you wouldn't practice without a stethoscope. But it really, there's a lot of activities that occur in healthcare outside of the EMR. So while it's critical to our success, we can't just be EMR focused, and that's really where we at Community have tried to build a platform and an ecosystem of technology and tools that are EMR focused, and but not just EMR centric as well.
And I'm imagining since those early days in 2012 when you started working in this kind of role and capacity, a lot has changed. But where do you also see where there could be still a lot of improvement moving forward in this world that you just described?
Yeah, a tremendous amount has changed in 2012. I mean, I think when you look at a COVID aside, but some of the things that we've worked on in the last 12 to 18 months. So I think about all the things that have gone on around information blocking and the patients being able to access their clinical and other information in real time. That was a completely foreign concept in many parts of the country in 2012. And so I think even just in 9 short years, we've come a long way in some of those areas. But really, a lot of the areas that we are focusing on and we have focused on is really that patient journey. How do we create a frictionless experience? And a lot of the friction that you see in healthcare really occurs outside of the clinical setting or the interactions. It's how do you manage referrals and how do you get information to patients? How do you help them along their journey to help them enable them to know what the next best step is in their healthcare journey? And so I think that's a lot of the areas that we're working on at Community Health Network is really what we call the white space. So it's the space that's in between the clinical interactions that a patient might have with a physician or a clinician. So how do we make that a much better experience? And I think when you talk to patients and when you hear about a lot of the frustrations that they have with healthcare and the health system, that evolves or revolves around billing and scheduling and access and all these other price transparency, all these other topics that you see in the news and you hear about. I think that's where we can really spend some time and start to focus and leverage technology as well.
Well, speaking of technology and speaking about that patient experience that you're just describing, obviously one big movement right now happening in healthcare and even beyond is automation. And that's something as the Chief Analytics Officer that you're well versed in. Dr. McGill, share a little bit about the state of automation in healthcare today and where do you see it heading tomorrow, both in the short and long term?
Right, that's a great question. So a lot of automation, in my experience, a lot of automation has been focused in the rev cycle area. That was probably the lowest hanging fruit, some of the easiest things to automate. We've had a lot of success automating some prior authorization and some other more administrative heavy tasks. So taking work off of the plates of our caregivers at Community Health Network. I think other areas are scheduling and getting rid of the phone tree, but getting patients and people to the right location. I think that can be achieved through some automation. Some areas that we've started to talk about, but I think it's going to take a lot of work, either through technology or conversations and getting people comfortable with it. Is automation in the clinical space. There's a lot of clinical workflows, if you think about it, that require a heavy human touch, but could be automated. Some things like refills and lab orderings by test ordering by protocol and health maintenance and other things that could essentially be automated. Now, there's some legal and regulatory things that have to be addressed as well. There's some human factor comfort from a physician kind of giving the control over to some of this automation. I think that there's some transparency issues that have to conversations that have to be discussed around what automation means and the ethics and everything else. But I think there's a huge opportunity for automation, which really, if we can remove some of those routine, repetitive, mundane tasks off people's plates and allow them to really, kind of a cliche term, to work at the top of their license, I think that's where automation can really bring some of the joy back to the practice of medicine. By eliminating those tasks that nobody likes to perform, and allow people to really practice for the reasons that they went into medicine.
Well, and I think it can happen across the board, no matter who the healthcare worker is, right? Let's
Absolutely.
get some of those automations in place, no matter who he or she is, so we can start giving them, as we like to say here at Olive, superhuman powers, right? A lot of us come into this industry, very, very excited to transform the health of our members in our own communities, right? And it's a great way to give back. It's an amazing career to be in healthcare, as you know. It's an honor to serve in this industry. But man, if we can start pushing some of those automations, as you said, not just administratively, but also clinically, imagine the human potential that we can unleash. So thank you for sharing that, Dr. McGill. It's a great perspective. Well, now we're going to start getting the crystal ball out, Dr. McGill. We're just going to start talking a little future state, but let's first start with today that's then going to springboard us into tomorrow. What's the biggest challenge from where you sit, not only as a practicing physician, but obviously as your chief analytics officer and all the work you're doing there? What's the biggest challenge currently facing the healthcare industry, and why?
I'm going to give you two big challenges.
Bring it.
One is labor. So we've gotten through the pandemic, or at least we thought we were now with the surge from the Delta variant. People are burned out. They're frustrated. They're frustrated with the politicalization of vaccines and everything else, and we're seeing a lot of compassion fatigue. Not only that, the labor market for healthcare is on a trajectory that I think everybody would agree is completely unsustainable. We've lost people out of the healthcare labor market, either going to other industries or they don't want to put themselves on the front line. Completely understandable. We've got people who have left because of burnout. I think healthcare labor is probably the biggest challenge and the biggest risk to our healthcare system as a country. The second piece is really, how do we move forward with the pandemic, costs of care. You hear about all of the disruption that's coming on the big players, Amazon, Google, Apple. And I think this fear of disruption, there's this fear of disruption fatigue. So every news article that you open is about another, somebody else coming to disrupt healthcare, somebody else coming to disrupt primary care, specialty care. And I think there's this ongoing, you combine that with the labor issues that we're having, this fear of disruption, and it creates such an uncertainty for the traditional players. Not to say that they shouldn't change. That's not what I'm saying. But it's this collective, the future is still unknown. We thought if we got through the pandemic, we would be on the other side of the mountain and we could look forward. Well, now on the other side of the mountain is another mountain. And I think people are frustrated with that. And it's creating a lot of uncertainty and instability that's going to take a long time to play out.
That's an interesting perspective, Dr. McGill, and I think it's one we should chat a little bit more about. And it's this notion of disruption, right? And I will say, I'll respectfully push back. We just recently saw an article. Google Health is dismantling a little bit. We saw their president head over now to the CEO of Cerner. We're seeing Apple retool a little bit. So it's not as easy as everybody thinks to come in and disrupt healthcare, but you are spot on when we think about all of the healthcare workers in this industry every single day giving it their all, and they continue to hear that message. You're right, it's a mountain upon a mountain. So is there an opportunity to collaboratively innovate? I hear the word disruption, I get it, but when we start thinking about entrepreneurs, technologists, startups, these innovative companies that take, to deploy new models with new, technology-backed models, is there a way to collaboratively innovate with leaders like you, with incumbents, people that, because this is a very complex industry, is there an opportunity to do it together?
I absolutely think there's an opportunity to do it together. And it goes back to what we talked about earlier. A lot of the frustrations and a lot of the things that even drive up the cost. So if we look at it from all perspective, so the employers and the patients are frustrated with the cost of care. It's become unsustainable, right? Insurance premiums have gone up, the cost of, and that's being driven by the cost of care, and that's just unsustainable. We would all agree with that. So high cost, lower quality, and a lot of that's being driven by some of the friction that we experience. So let's partner and innovate to reduce the friction. We hear about the word consumerism, and that's where I think that you don't have to break down the entire system, because fundamentally, you still need doctors and nurses and pharmacists and pharmaceutical companies and everything for the system to work. So they're going to need hospitals and ERs and doctors' offices. But let's partner to really attack the friction, improve the quality, be transparent about it, and then really try and drive down the cost of care. I don't think, it's my personal opinion, I don't think the way the system is currently constructed, it can be disrupted. It's too massive. And I think that's why you're seeing Google and Apple, they're coming into the fray, and then they're going back out saying, we can't attack this. We're going to have to do it in a different way.
Some may argue that the system is running exactly how it was constructed to run, right? It is actually running exactly the way it was built to run, right? So we need to think anew with all players and all constituents at that table, right? It's a very complex and a very multi-sided industry, right? Payers,
Right.
providers, consumers, patients, however you want to term them in that equation. It's a very complex equation. So I'm right there with you, but I think we can do this, and I think we can do it together. We're going to have to do it together.
I absolutely agree with you. It has to be a collaborative effort, and it has to be everybody has to come to the table. Insurers, employers, providers, patients, everybody has to come to the table. Governments to have a voice and an equal voice at the table to really drive the improvement.
Dr. McGill, Executive Vice President, Chief Analytics Officer at Community Health Network, thank you so much for taking time out of your day. I know how busy you are, and we do appreciate your time and all of your thoughts and leadership as we continue to work together to create the Internet of Healthcare for our nation. Thank you, Dr.
Absolutely.
McGill.
It's always my pleasure. Thanks for having me on.